Now, cervical cancer kills around 700 women a year in the UK, and we know that some of them could have survived if the illness had been detected sooner.
And while some women are reluctant to attend cervical screenings, a new trial has shown that they are more likely and more willing to use a DIY home test to detect HPV. That's the virus that can lead to cervical cancer.
Well, the latest figures show that more than 4.5 million people are invited for a smear test each year, but less than 3.5 attend.
The trial by King's College in London involves giving HPV detection kits to women who hadn't taken regular smear tests, and when those kits have been given by a GP for a woman to use at home, it's shown that more than half of them did return a sample.
Well, we're joined now by Dr Aziza Sesay, who's a GP and ambassador for the Eve Appeal, a gynaecological cancer charity, and cervical cancer survivor and campaigner at Berridge. A good morning to you. And you've brought along some little friends as well.
I did.
In order to demonstrate.
So excited.
Do you know what? I am one of these women who's guilty of when I get that letter saying you're due a cervical smear, of my heart sinking and thinking, not again. And because of the instruments we have there. Do you want to talk to people who might not know how it works when you go to the GP through those instruments and how it works and why it's off-putting for a lot of women?
Of course, absolutely. It is such a common theme. And actually, I brought the props because I thought it would be really helpful to showcase. So really quickly, do you know what this is, John?
John, I am aware of this, yes.
So this is the internal
work.
I am aware of this. I remember biology O-level.
Yes, yeah. So this is internal gynecological anatomy. You have the ovaries on either side, fallopian tubes, the womb, the cervix, which is where we're testing, and the vagina. So how it works is, when you go to the GP surgery, you'll have a conversation with the nurse or the GP who's doing it. They'll talk you through everything that's involved. And then they pop in this speculum. This is a small size speculum. They come in different sizes. You can request for a small size. They put it in, and then they open up the vaginal wall so that they can see and visualize the cervix. And then they use this brush, which they put into the vagina, and turn it around a few times to get the sample, take it out, and then pop it into this sample pot and send it off to the lab. So that's how it's done traditionally. Now, the great thing about this HPV self-sampling is that you can do it yourself. And I don't have a sample here, but basically, it looks like a swab, cotton wool swab, or, you know, the long COVID swab that we use, similar to that. And what you do is, as an individual, it has instructions. We talk to patients through how to use it. You use the long swab. It's about this length, but you only need to put your finger about halfway through. There's usually a demarcation, and then you can stand with your legs propped up on a chair or on the toilet if you're there, or you can be seated, pop it into the vagina in a similar manner. It probably gets about halfway. So once you feel the swab on your skin, onto your vulval skin, then you're in. Turn it around for 20 seconds, take it out, pop it into the sample pot, and then send it off to the lab.
Oh, wow, that just sounds a lot less invasive. You're not having to face a stranger doing it. I've had a couple of strangers do it to me when I've gone to a sexual health clinic. And then you're just popping it back in the post and it's done and dusted. Karen, how much of a difference could this make to women? Because so many women are put off from going for a smear, and it's literally life-saving.
It is. I think you can do it at home yourself. You've not got to sit in front of a doctor, or, you know, it's a very private thing for lots of people, and people struggle going to the doctors and getting appointments even sometimes. So being able to do it at home, it's, you know...
And you both have lived experience, don't you, of having those tests come back and say, I'm sorry, there's irregular cellular activity here. What's that like?
For me, it was life-changing. I got diagnosed with cervical cancer in January of 2021. It was very early stages, but I'd had no symptoms. It was picked up from a regular cervical screening 2 months prior. And unfortunately, that led to surgery and all of that comes with it. But fine now, all good. But it's devastating when you just don't expect it. I'm a normal person, mum of 2, healthy, fit and well, yet, you know, cancer was still knocking at my door.
So your experience, your story is proof of why testing is so important. And Aziza, you were saying you're excited by this new testing. I guess because you can potentially reach women now who don't want to, are not comfortable with going into the surgery for testing by a stranger, isn't it?
Absolutely. So when we talk about this testing, it tests for HPVs. That stands for human papillomavirus, okay? So this is a very common virus that 80% of us will have at some point in our lifetime. And there are 100 different types. There are 13 that are associated with cervical with cancer, and that's called high-risk HPV. So we test for this high-risk HPV because we know that cervical cancer is 99.8% associated with HPV, right? So the HPV self-sampling tests for it, and if you have it, then you move on to potentially have this cervical screening done at your GP surgery. But if you don't have it, then we know for sure. So we're able to pick up non-attenders, those who don't have time, those who are scared, like you say, to have the testing
Is there
done.
any danger of a false negative because if somebody does it wrong and maybe doesn't pick up those cells, or is it guaranteed to collect?
So the fact of the matter is, for any sampling in general, nothing is 100%.
Right.
There will be an element of human error. However, there's explicit explanation, step-by-step guide with picture imagery telling the patient how to get it done.
So you'd be confident of the accuracy?
Well, we'll be confident that it's accurate enough.
Okay.
Right? I
was thinking, you're mentioning COVID. I mean, obviously, this is very different from a COVID test, but it took a long time for us all to get used to doing that, didn't it? And this is a one-off test that you only have one chance. Yeah.
Well, to be honest, we do this all the time anyway. So I, as a GP, have patients do self-swabs for, if I want to test for infections. Okay. So it's not something that would be really new for a lot of people. And there's so many self-screening tests out there. There's the bowel cancer screening test, like we said, the long COVID swab screening test. So many out there that people are proficient in doing.
And Karen, this isn't being rolled out fully yet, is it, via every GP surgery? No. So if you did want to take up this kind of testing, what's the best thing to do?
I think to speak to your GP about it, because it's not being rolled out yet, but they will know it's coming. And also the Eve appeal that you're an ambassador of, I'm working with at the minute, they'll have lots of information to talk about what's coming, and because you can't always do it now, there's other methods and other ways of communicating.
Don't keep putting it off.
No,
it's made me think I'm going to book in when I get home.
Please, anybody who's watching this, please book in. Cervical screening is life-saving. They say 70% of cervical cancer deaths are prevented by cervical...
70%?
Of cervical cancer deaths prevented by cervical screening. Please don't put it off. And if you want some more information, you can access nurse@eveappeal.org.uk.
Fantastic.
Thank you both so much. It's good to see you looking well.
Yeah, it is good to see you both looking well. Thank you.
Positive story. Thank you.
And bringing in a knitted vulva. We weren't expecting that this morning, were we? Thank you, ladies.
To be honest, Nina, when you've done this job for a couple of years, nothing surprises you. Thank you very much indeed.
Thank you, guys.